Hello, my name is Irvin Varkonyi with Supply Chain Operations Preparedness Education with my partner, Greg Schlegel, who is founder of the Supply Chain Risk Management Consortium. We are pleased to be a part of the Global Health Supply Chain Conference. Our brief session will offer an overview of the landscape on supply chain risk management in public healthcare. This is a topic which has impacted the entire world, where governments and the private sector have sought to reduce the loss of life while maintaining economic activity which sustain nations and their citizens. The challenge of such a pandemic is unprecedented due to how strongly interconnected our world has become. Our session will offer perspectives on the challenges of brittle supply chains. We will introduce tools developed by our consortium, such as online courses in supply chain risk and resilience, help organizations become more resilient. And we'll review future trends in public healthcare supply chains, an industry which has been trying to catch up to 21st century global supply chain practices, but was greatly thrown off balance by COVID. Enjoy our session. Let me ask our co-presenter, Greg Schlegel, to tell you a little bit about the consortium, its activities, and its goals. Greg?
You bet, Irv. Thanks a lot. Folks, the consortium has grown to include 30 companies and about 1,500 supply chain risk professionals around the globe. We operate in 23 countries. We've been teaching and consulting in this space for over 10 years. These members in the organization that you can see, they bring tools, techniques, methodologies, and solutions that help all of us identify, assess, mitigate, and manage supply chain risks. Irv?
Thank you, Greg. What is the foundation on which the consortium and supply chain risk management is built?
Great question. The consortium grew out of a first-of-a-kind MBA class on supply chain risk and resiliency at Lehigh University 10 years ago. We have two basic definitions. One is, what is a resilient enterprise, from the book? A resilient enterprise has the capacity to overcome disruptions and continually transform itself to meet the changing needs and expectations of its customers, shareholders, and other stakeholders. Folks, that's a tall order. That's the why. The what and the how is what we call supply chain risk management. It is the implementation of strategies to manage everyday and exceptional risks through your entire supply chain through continuous risk assessment with the objective of doing what? Reducing vulnerability and ensuring business continuity. Think of it this way: intersection between good supply chain management and excellent risk management. Irv?
It's noteworthy, Greg, that your book was published several years before the COVID pandemic. It's unfortunate more organizations and their CEOs did not pay enough attention to SCRIM before COVID. So what does the public healthcare supply chain landscape look like?
Good question, Irv. We want to share it with the audience. Here it is, folks. The public healthcare supply chain landscape, as you can see, is quite large, quite wide, and very deep. Looking at the landscape vertically on the left side of the slide, top down, it starts with international scope, then migrates down to the national level, then the regional, down to the district, into the cities. It moves down to small towns and ultimately to the patient. So it's quite an extensive hierarchy. And if you look at the landscape horizontally on the top, the complexity continues to grow via the private sector. You're working in the public sector and the NGO sector. So the bottom line is a very deep and wide supply chain community covering production, government policy, and distribution, which it is all fraught with many challenges, nuances, and risk. Irv?
Greg, public healthcare has a major role in supporting the growth of less developed nations by protecting the health of their populations. What has COVID done to expose the vulnerability of these public healthcare systems?
It's a good question, and it really, truly has exposed the fragility and rigidity of public healthcare supply chains. And we have a couple of challenges coming out of our course that we want to share with you. One, there's diffused accountability, uncertainties in financing throughout the entire landscape. There's unnecessary levels of complexity, long resupply intervals. There's a lack of interest in funding operating costs. There's a lack of supply chain planning data. There's a mismatch between skills and system designs, and there's a lack of incentives for supply chain staff. And we could go on, but we wanted to share with you just some of the challenges and nuances in this complex supply chain. Irv?
Greg, those are considerable challenges to deal with. The world is dealing with seemingly unending ups and downs and trying to restore normality in supply chains. Is this the new normal?
Good question, Irvin. That's really, we believe it is. And this is why we came up with the W like recovery and what we call the 3 R's back in March of 2020. So we'll just give you a thumbnail sketch of what you're looking at. All right. On the top of the slide, left to right, are all the government imposed mandates from lockdown, reopening, first normal, nth normal. On the y-axis on the left is what we call our segmentation of global supply and demand arena. On the top of the y-axis is what we call an over-demand and under-supply of product. Then in the middle, in the green, we have a supply and demand balance in relative balance going forward. And then on the bottom left, we have the under demand and oversupply dilemma for product. And then on the bottom x-axis, we put together business responses, and there you see the 3 R's: respond, recover, and renew. We don't have time to give you context in detail, but just think of it this way. We think this bullwhip effect is going to be with us through the middle of 2022 because of supply and demand shocks, the latency inherent in every supply chain to rebalance itself. So we think it's going to look like this, get better all the way through the middle of 2022. Irv.
Greg, it almost seems like organizations of all types are trying to modify the supply chains while simultaneously dealing with COVID, as if you're trying to fix an airplane while it's flying. Is a key to managing the processes and improving public health care the skills and knowledge of its workforce? And if so, what can you offer to address this?
Great question. What we've done, you can see some of the impetus. What we've done over the last year and a half is put together a 3-level course in supply chain risk management dedicated to the public healthcare arena. And we have a 3-level course, and it looks like this. It touches tactical, operational, and strategic. The tactical is essentially an introduction to new terms, definitions, and concepts. In operational, we attempt to operationalize the tools, techniques, and methods to make sure that we enable you, the learner, to drive impactful supply chain risk and resilience in the public healthcare. And then the 3rd level is strategic. And essentially, when you go through strategic, it attempts to put all the tools, techniques together. And as a learner, upon completion of the 3 levels, you will acquire knowledge and insight to enable you to identify, assess, mitigate, and manage supply chain risks. This will culminate in earning a supply chain risk and resiliency certificate in public healthcare from Lehigh University. Irv?
Greg, what has been the reaction of those who have taken these courses?
Again, good question. We've had many testimonials. As you can see, we've supported and have heard from many supply chain professionals, logisticians, project managers from several public healthcare NGO organizations. And so we're very pleased to receive these testimonials, and we just wanted to share with them, essentially share with the audience some of the testimonials from the 3-level course. Irv?
Greg, thank you so much for your comments on this important topic. Allow me to summarize the highlights of the session. Post-pandemic supply chains will not be the same. That's the new normal that Greg had mentioned. supply chains won't immediately transition into new ways of operating. It will take time to rebalance supply demand into a new normal. In the new normal, visibility, resilience, risk management, diversity in supply and trade-off analysis will rule the day. New forms of transportation, warehouse-related elements, and new policies and procedures will emerge during this new normal. And finally, supply chain innovation will be essential, and collaboration along the entire supply chain, value chain, will be the critical success factor for future NGO and public healthcare act success. Thank you, everybody. We hope you have enjoyed this session, and thank you for watching. We look forward to your questions and comments. Please address them to Greg at the email address that you see below, and have a great rest of your conference.